Let's see about fibrosarcoma. So fibrosarcoma comes under malignant tumors of connective tissue origin. So fibrosarcoma, all the sarcomas are malignant tumors. So fibrosarcoma comes under malignant tumors of connective tissue origin. So fibrosarcoma, it is a tumor of mesenchymal cell origin that is composed of malignant fibroblast in collagenous background. It can occur as a soft tissue mass or as a primary or secondary bone tumor. So it is a tumor of mesenchymal cell origin. It can occur as a soft tissue mass or primary or secondary bone tumor. So the sarcoma as a group differ from malignant epithelial neoplasm by their typical occurrence in relatively younger persons and their greater tendency to metastasis through the bloodstream rather than the lymphatics. So sarcoma, what are the difference from the malignant epithelial neoplasm? These are the tumor that most commonly occur in the young peoples and it spread through the bloodstream, not the lymphatics. So it has two types of fibrosarcoma of bone exist, primary and secondary. The primary fibrosarcoma is fibroblastic malignancy and it produces variable amounts of collagen. It is central, arising within the medullary canal, or peripheral, arising from the periosteum. So primary fibroblastoma is a fibroblastic malignancy. And the secondary fibrosarcoma of bone arises from a pre-existing lesion or after radiotherapy to an area of bone or soft tissue. So this is a more aggressive tumor with poor prognosis. So secondary fibrosarcoma is very aggressive than the primary fibrosarcoma and it is have very poor prognosis. And what are the etiopathogenesis? Fibrosarcoma, like other soft tissue sarcoma, it has no definite cause. And several inherited syndromes like multiple neurofibromas may have a 10% risk over a lifetime of developing a neurosarcoma or fibrosarcoma. So inherited syndromes like multiple neurofibromas. The exact cause is unknown. And the genetic mutations are the translocation T, that is 12:5 and P13:Q25. It giving rise to ETV6 and NTRK3 gene fusion. So it is absent in other spindle cell tumors of childhood as well as the adult fibrosarcoma. So these are the genetic mutations. These are the reasons for fibrosarcoma. So what are the fibrosarcoma also has been noted to arise from pre-existing lesions. What are the pre-existing lesions that cause fibrosarcoma are fibrous dysplasia, chronic osteomyelitis, bone infarcts, Paget's disease, previously irradiated areas of bone. These are the conditions or pre-existing lesions may arise or give the fibrosarcoma. So these lesions are very aggressive and are associated with much poorer outcome than the primary fibrosarcoma of the bone. What are the clinical features? Fibrosarcoma of the bone, it is most commonly or higher incidence in men than the women, and fourth decade of life it is most commonly occur, and usually in lower extremities, that is femur and tibia, and arises in the soft tissue of the thigh and posterior knee, and large painless mass deep to fascia and has an ill-defined margin. These are the clinical features. An infantile form of fibrosarcoma exists. Sarcomas involving bone, these are present with pain and swelling after a long duration of symptoms, and it may grow large, so it produces pathological fractures. So this is the infantile form. Infantile form occur in children less than 10 years. So these are the clinical features. The sarcomas involving bone often present with pain and swelling after a long duration of symptoms. It may even grow large and threaten the structural integrity of the bone and cause pathological fracture. The soft tissue sarcoma most often present as painless masses. The duration is often shorter than with lesions involving the bone. Because these lesions often arise deep in the muscular fascia, they become extremely large tumors prior to diagnosis. What are the differential diagnoses of fibrosarcoma? So the differential diagnoses include fibrous dysplasia, fibrous histiocytoma, osteosarcoma, paget sarcoma, malignant fibrous histiocytoma, malignant neurosarcoma. These are the differential diagnoses of fibrosarcoma. So, fibrosarcoma, it is a tumor of mesenchymal cell origin. So, these are the differential diagnoses for fibrosarcoma. Fibrous dysplasia, fibrous histiocytoma, osteosarcoma, paget sarcoma. And next, moving on to histological features. Fibrosarcoma or tumors of malignant fibroblast. It has three forms or three vary in histological grade. The first one is well differentiated, and the second one is intermediate grade, and third one is high grade. The first one is well differentiated form. Its forms have multiple plump fibroblasts with pale eosinophilic cytoplasm and deeply staining spindled nuclei with tapered end. So there is a deeply staining spindled nuclei with tapered end, and the malignant cells are dispersed in the rich collagen background, and the lesion is typically scattered. And histologically normal mitotic figures are seen in small numbers, but cells and nuclei are not pleomorphic. So this picture showing the low power appearance of well differentiated fibrosarcoma. The tumor has a monotonous hypercellular look with regimentation of nuclei. Mitotic figures are common. So here the mitotic figures are common, but cells and nuclei are not pleomorphic in well differentiated stage. And the second one is intermediate grade. Here the tumors are cellular and have the typical herringbone pattern. So it is a classical sign of fibrosarcoma, herringbone pattern, showing the diagnostic parallel sheets of cells arranged in intertwining rows, and quite cellular with slight degree of cellular pleomorphism, but moderate amount of mature collagen may be produced, perhaps with areas of hyalinization. So this picture showing the fibrosarcoma showing moderate degree of nuclear pleomorphism. So there is seen this picture showing the nuclear pleomorphism. This is the moderate degree of fibrosarcoma. And the third one is high degree. Here the lesions are very cellular with marked cellular atypia and mitotic activity. So the matrix is sparse and multinucleated giants are rarely seen. No malignant osteoid formation should be present, and high grades are extremely anaplastic and pleomorphic with bizarre nuclei that bring to mind the histological features of malignant fibrous histiocytoma. So here there is no malignant osteoid formation. And next, moving on to the sclerosing epithelioid fibrosarcoma. So what is sclerosing epithelioid fibrosarcoma? It is a uncommon tumor of deep soft tissues and predominantly of small to moderate size, round to ovoid, relatively uniform cells, clear cytoplasm embedded in a hyalinized fibrous stroma. So sclerosing epithelioid fibrosarcoma, it is uncommon and it is a tumor that occurs in the deep soft tissues. And what are the treatment and prognosis? Tumors require radical surgery, including removal of potentially invaded muscle and bone. And chemotherapy is not used, and radiation therapy is given with surgery. This is all about treatment and prognosis.